We have a graphic of where the epidural is inserted. So let's take that, and thank you, Lauren, for correcting me. That's my producer. Doctor, show us where it's injected and how it works.
Well, the epidural goes right. If you look at there's 3 arrows there. First, the spinal cord, the subarachnoid space, and the epidural space, okay? And the last one, you see the needle going right at the epidural space, okay? So the idea is that it goes right where it's located between L3 and L4, lumbar spine 3 and lumbar spine 4. And the needle goes in that space, which is called the epidural space. If you go a little too far, you get the subarachnoid space, but definitely in the wrong place, and those give you severe headache because you bleed and all that. But the area is that white area between the red and the blue that is so nicely demarcated there. Of course, in the real people, we don't have those colors. I don't have that space, so you have to have the ability to place the needle right in that space.
Do you have a lot of moms that say, no, 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 I don't want one, and then they decide, give it to me?
Yes.
Now!
I get a lot of patients that come in and tell me that somehow patients feel that if they're getting an epidural, they're not getting a natural delivery. I don't know where that came from, but it's somehow out there. And I think that is so wrong, because the epidural does not change the way you deliver whatsoever, in the sense that natural birth is when the baby comes out through the birth canal, and the other one's the C-section. So having an epidural does not change your natural birth. And so we get a lot of patients that come in and say, I just want all natural, and I want to make... I'm not saying that an epidural is for everyone. There is other instances and other pain management. I think we're going to discuss that a little further.
We are.
But I think the epidural is ideal for the majority of patients. It gives them the ability to really control the pain, relax, enjoy the labor, and don't smear the makeup.